to our second session, and now we're going to talk about planning for parity, how to prioritise and what to prioritise for women's health. And I'm delighted to be joined on this panel by Dr. Sumi Dunne, who's a GP and women's health expert. Joanne Healy of Bank of Ireland is still with us, as is Dr. John Gallagher from Cognate Health. And Stephanie Brady has joined us, Head of HR for Retail in Motion. Lovely to meet you both. Thank you very much for joining us. Thank you to Joanne and to John for staying with us as well. One of the key takeaways from the index is that women's mental health and well-being has improved. So that's a good thing. 36% reporting good or very good mental health and well-being, and that's compared to 30% in 2022. I'm going to begin with you on that one, Sumi, because that's a good statistic. That means we are heading in the right direction for many people, but it's the other side of the equation that we have to be worried about as well, isn't it?
Absolutely, Jonathan. I mean, it's great to hear, but we can do so much better. And when we look at the impact of mental health and well-being on women in the workforce, we recognise that there's a continuum. And there are unique bespoke elements around women's health that can have impact on this, which possibly we're still not addressing in an equitable manner. You know, and it was spoken earlier about health through the decades. So if we start, you know, women menstruate, full stop. We can't get away from that. You know, we've spoken the M word, we menstruate. And that impacts in your 20s, 30s, 40s and 50s. And there are younger women coming into the workforce on a daily basis, anxious, because they don't know what's going to happen if they get period pain. Simple. Which,
when you think about it, is kind of nuts. It's not new. It isn't something that has happened in the last 5 years that all of a sudden HR departments have to catch up on. But it just shows you that there are disproportionate challenges that women face.
And that can be when you're 30, and that can be when you're 40. And then you've got the added layers together with that. What happens if I bleed very heavily? You know, is my workplace environment set up to support me? Are there comfort packs accessible to me?
Even that small token gesture, and it is a token gesture that you provide free sanitation products in the ladies, you know, that was unthought of many years ago. But you know, so are we moving in that right direction? We talked about stigma being removed from mental health in the last session. Are we kind of heading in that direction when it comes to women's health?
We're getting there. We haven't got there, we are getting there. And I think what is really encouraging is that women are coming back to the likes of myself and able to start the conversation to say, this is the reason why some of my anxiety is being triggered. You know, I have to travel, so I've got to think about my commute. I've got to think ahead. You know, can I sit on the train? If I'm at a meeting, I'm looking at the light-coloured chairs here. I'm thinking of the women in the audience that might not want to sit. If you've ever been at a business meeting, look around the room and notice, you know, how many women may not choose to sit for fear of staining a chair. You know, and unless we're open and we acknowledge and we say this, it's a very practical aspect that we can look at. We've got other aspects as well, moving through women's health. We've got the unspoken, you know, aspects around infertility. Women don't talk about that.
Just on that point of infertility, I mean, that's a conversation that was never had before.
Never. Never. I mean, you know, we can even do a look back to 5 years. 5 years ago, that was a conversation that just didn't happen. Could we talk about it in the workplace? Could we bring our anxiety to the workplace around that? Did we have to engage in conversations of other people in the workplace around family events, moving forward to holidays, possibilities of you will cover me, I've got to get away for a school holiday or a school event. And yet this untold aspect that was just sitting there, we're talking about it now. There are supports coming forward. There are more supports, and luckily there have come more supports at a much more equitable level this year, which hopefully will move forward these conversations.
Before I bring in the rest of the panel, there's one other statistic that stood out for me, and it's almost the other end of the coin when it comes to issues that women face. 2 in 3 women claim to have worked when they should have been off sick. And now this is the old adage of, they can't do without me. The world will end. It'll all fall apart. I can't tell them I'm sick, or I can't tell them there's something going on in my life that will result in me not attending work. Why are we still doing that? If you're sick, you're sick.
Absolutely. If you are sick, you're sick. I think one of the positive aspects that did come out, very small out of COVID, was the recognition of being sick and the recognition of the importance of rest. Because if you don't rest and if you don't recuperate, you are not giving yourself a chance to reset that balance. So not only do you have the physical stresses of a viral illness or a bacterial illness, you've also got a changing cortisol pattern. Cortisol drives our stress. And if we are stressed, we're not going to get better. We're not going to be able to fight infection.
But you see, the employer will turn around and say, "Oh, it's okay. She's working from home anyway. She'll take calls. She can turn her camera off on the Teams call." Is that, that solution is bandied around? Is it an option?
It's not a solution. Illness is defined. Physical illness is defined. Mental health illness is defined. And as a clinician, I would say there's equal parity to both. And recuperation around both is pivotal. And that's another door that needs to be open. If we are unwell, we need to recognise our markers of illness. And we also need to recognise that we need time to get over it. The days of superheroes, let's consign them to the big screen.
Yeah, I have to say that there was always something, because I worked in radio, which is, and still do work in radio, but it's one of these great jobs in life that in an instant you could be gone. And it happens all the time. And, every time I sat into the chair thinking, I am invincible, this is great, it's fantastic. If you got hit by a bus, someone else would be sitting there tomorrow going, I am invincible, I am great. It doesn't work that way. You can always be replaced, no matter how important you think you are. One of the things, Joanne, we want to talk about, we talked about menstruation, but the other big conversation, we touched on it in the first session, is the menopause. And it's almost as if the media and society in general has realised that women are impacted by the menopause and it does some jolly terrible things to women as they're trying to, live their lives. We have started addressing that stigma. The media, ignoring it, did a lot of damage. Now we're having the conversation, is it helping the workforce?
Absolutely, and I think that awakening, has actually been credited to Joe Duffy a few times, but it's always a man, isn't it?
I was going to say more Davina McCall, to be fair. I give Davina the credit.
I'll credit it to Davina. And absolutely, it's been something we've definitely been looking at Bank of Ireland. We've been on quite the journey over the last couple of years. We introduced a menopause policy in 2022. So that entitles colleagues who are experiencing menopause to 10 days paid leave from work in any rolling 12-month period. And that's to kind of attend appointments or for illness relating to menopause. And that kind of thing, it can be taken flexibly, it has to be that kind of common sense approach that, it can be taken at the last minute, half days, full days, blocks, And I think, look, a policy is great, but we need that support to be felt on the ground. We need every woman to feel that actually applies to them and they feel comfortable in taking that leave and talking about this. So we've done an awful lot in the awareness space as well for women's health in general, but a lot on of webinars with menopause experts where people have a chance to kind of ask questions they might have never had the answer to before.
One of the fascinating insights that's come out from the survey is the understanding of women in the workplace themselves about what a menopause policy looks like, because 2/3 of female employees now feel it's important to have a menopause policy in place. It's kind of obvious when you think about it, and you'd wonder what the other third are thinking if they don't think there should be a policy. But that's up from 10% in 22 and 13% in 23. So it just goes to, this was taboo. You'd have been more welcome talking about the plague in the workplace than talking about the menopause, by the sounds of it.
You're right, you're right. And it is women that need to be educated as well, because we hear so many stories of women fighting for answers 3 years into experiencing different symptoms, and then all of a sudden a light bulb goes off and goes, this is the menopause, or perimenopause. So absolutely. And I think, what's been interesting for us is all of these webinars have been vastly, I look at the attendance lists afterwards and they're vastly female names, right? There's a handful of men.
I'm coming to John in a second. I'm building up my question to him. But carry on.
Yeah, and so, but it is, which is disappointing, because it's for everyone. But at the same time, it's women who need to talk about this, and the chat is on fire for these sessions, people really needing to share their experiences and find that empathy with one another. So we need to be able to facilitate that as much as possible.
John, that statistic is interesting about the women having that conversation. Men in any office environment, we don't have the menopause. We've never menstruated. We have had a pretty good run as a gender. Is it harder for men to accept that, this is actually what the right thing is and we have to support these policies as opposed to not understand them, which men have gotten away with to this point?
We do. I thought you were going to ask me what am I doing here, but no, we do. It needs support. I mean, I suppose just looking back at some of the thoughts, I think it's 6% of women have got significant enough menopausal symptoms to impact on their performance. Yeah,
Absolutely.
and about 30 to 40% need to take time off. Those are the sort of figures that I was coming across. So it was only a matter of time, really, that this got up the agenda. And I think that's probably got to do with an acceptance that this is a real issue. Funnily enough, when you look at, as people referred into us, it doesn't figure. I mean, women's health is low single percentage figures. And there's probably a number of reasons behind that, yeah? So let's look at that. The first reason is, are they not presenting with these problems to the manager? Is that stigma, taboo? Is it something that, is it because they feel it's part of their normal health process and not necessarily a medical issue or a sickness issue? And when they do present, our manager's not taking it seriously. Yeah? And the third option, which I quite like actually, is the even when they do present, are they not being referred to us? And does that mean the problem is being dealt with locally? Now that would be really advantageous if it's a third of those. I don't know the answer, by the way, why they aren't coming through, but it's probably a good thing, because I think the worst thing we could do here is medicalise this whole process, right? So you present, you're referred off to occupational health, you come back with things that accommodate. You don't need to go there. And menopause policy, I think, can deal with a lot of that and not medicalise the process at all. But that takes really an approach where you change the culture, you change the narrative, you change the acceptance of the issue in the workplace.
Sumi, if I could come back to you, one of the other things, speaking to female friends, is when women hit that age where they're starting to experience symptoms and they're going through the perimenopause, or the menopause has kind of come on them in a way they weren't expecting, sometimes finding access to the right doctor is a challenge. There are the doctors that are known. She's really good. He understands it. Like, GP training is probably a little bit behind the curve on this as well, isn't it?
If anything, as a group, as a body of professionals, we've really sped up around training around the perimenopause and the menopause. There have been an invested group of us as clinicians that have been working behind the scenes for years to promote around menopause and looking after yourself in the perimenopause. And what I saw, and what a lot of us saw, and why we moved forward with this, was that so many women were coming forward with a myriad of symptoms and tragically being over-investigated, tragically being sent down the route of a heart specialist, or being sent down the route of a neurologist, or being sent down the route of a pain specialist, rather than actually somebody listening, validating symptoms and bringing it together. We now use a validated score, an evidence-based score called the Green Score. It's been around since 1976. This isn't new. And this is a self-reporting questionnaire that everybody can have access to. Employers can give access to that. And people can self-report their symptoms. And bringing it into somebody like myself thereafter gives me 90% of the work. And very recently, Joanne and I were together talking about menopausal symptoms at a national summit. And one of the key topics and messages that came through, and I would echo this, is that your symptoms are valid. You are valid. So please do come in, find that door and talk to us.
I mean, and again, I haven't gone through it, but I know women, like, some people just think they're going crazy.
Absolutely.
I mean, they just feel as if this isn't me, this isn't how I have been, this is not how I see myself. Totally. What in the name of God is going on? You need to have that validated.
No, absolutely. And you will have really great women who will come in and say, Sumi, this is not me. I don't know who I am. I would be the first to stand up. I'd be the first to do a presentation. I would be there at every event, supporting, promoting my colleagues. All I want to do is stand behind the scene.
Yeah.
I don't want to be involved. I've got an anxiety. I've got palpitations. All of that is so real, and to recognise that. And what's really, really interesting is that the perimenopause is a clinical diagnosis. So bloods don't really matter. Talking matters.
Well, thankfully, that conversation is happening now, and it's happening in a way that didn't happen before. Another conversation that is happening that didn't happen before, the percentage citing fertility support according to the index to retain talent rose to 21% in 2023 from 11% in 22. So fertility journey and the importance of the right support is becoming much more important. And we are a bit behind the curve when it comes to menopause, which is hard to believe, given how quickly that conversation has happened. But fertility is really, really important, Stephanie, isn't it? Because if we don't have that conversation, you don't know what's happening in people's lives. You don't know what's going on. And the impact of infertility can be massive.
Huge. One very interesting thing, though, is it's so interconnected. So when I was finally diagnosed with my infertility, it was low AMH levels, because obviously I started a family late, which most of us do these days. And my doctor said to me at the time, you're going to go into early menopause. Now I wasn't even thinking of that. I was so busy trying to get pregnant. But yeah, early 40s, I'd had my baby finally when I was 39. Early 40s, I was going through all these things. What the hell is wrong with me? Am I going crazy? And, you know, going through all that. So I think the two conversations belong really well together. And I think we need to have a holistic view in the workplace to both. And it starts with fertility, but that very quickly moves into early menopause. You know?
We talked about taboos. Infertility is another big, massive taboo.
Huge.
It's not the kind of conversation where you move from maybe talking about what was on Coronation Street last night to you'll never guess what's wrong with me. So how do we broach that conversation? How did you broach that conversation?
Well, I have to say I was very lucky, and that probably helped with where I am now and with how we deal with fertility in our workplace. So I worked in a different company for 7 years, and I started trying to get pregnant in my mid-30s and wasn't getting anywhere, and very quickly went to the doctor because I was in my mid-30s. She then told me how to get pregnant. I was like, thank you very much. pretty
was
okay with
Was
that.
there a book? I'm curious, but we can't talk about it now.
Some diagrams, no, I'm joking. But no, it was very quickly fobbed off and told to go and try for a year. I'm like, I don't really have a year. So, you know, because your clock is ticking. And I knew there was something wrong. And that's the thing you were saying earlier. I knew there was something wrong. I knew even coming up to it, there would probably be something wrong because of my history. Anyway, had problem with fertility as well is you end up having a lot of little minor investigations and operations that you don't want to tell anybody about, but you need time, you need recovery time. Had some of that done.
You can't have the conversation. Why are you missing yesterday? Well, I went for a DNC, but I don't want to tell you about that. So these kind of things, you can't say that. You just take a day off and say, oh, I wasn't feeling well.
And then you come back too soon because you don't tell anybody.
Yeah.
So did that, got pregnant naturally, had a miscarriage, that I was able to talk about, but it was very difficult. Also, tried to move on from it too quickly. Then we get into mental health issues because my mental health, gave me a right kicking for a while because I just got back to normal. And then, 6 months later, I'm wondering why I'm having panic attacks and struggling and yada, yada, still not getting pregnant. Because everybody's like, oh, you're going to get pregnant so easily now. You've had a miscarriage, good to go. No. So then you go down the whole route of getting the investigation. So I'd say I probably did. It's terrible. They always say when you get your baby, you forget, and you do. People ask me about medication I took. I can't remember. Because as soon as I had my baby, So my husband tells me we had 6 IVF attempts. I finally had Sophie when I was 39. I remember my 40th as being a bit of a bleh because I was waiting to see if I was pregnant again on another IVF. I wasn't. So I had a very big 50th recently to make up for my 40th. Huge. Because I felt those years were just trying to get pregnant, not buying clothes because you might be pregnant. But I was very lucky. To go back to the start of my story, I worked in a company who were incredible long before their time. I worked for 2 male managers who gave me support I didn't even think to ask for. So at one point, my immune system was being suppressed because we were throwing the kitchen sink at it. And my boss said, I want you to work at home for a month. I was like, nobody worked back at home back then.
It wasn't a done thing at the time.
No. And I said, I don't need to work at home for a month. I'm fine. And he said, I want you to work at home. You cannot be in areas where there's lots of people with a suppressed immune system. Work at home. Just do it. We need you to have this baby. So I was so lucky. So when I went to writing the policy, because I do a bit of work with an organisation called NISIC, which nobody seems to know about, and it's phenomenal. I wouldn't have my baby if it wasn't for those 2 male managers in NISIC, because I wouldn't have kept going. It's so hard to go and do another one and another one. So if work was a problem, or I didn't have those people who understood, with fertility, you get sick of telling the story. So with NISIG, you can just start from where you are. You just go into a room and start from where you are.
But you've also used your experience
Yes.
to help other organisations navigate it. So if you didn't have a policy,
Yes.
you've won on the shelf that you've kind of put
Yes.
together now. How much did you take from that experience and put it into helping others?
Well, it was with NISIG. I was at a committee meeting one day and we were talking about publicising them, and we were saying how difficult it is for them to get into a workplace because nobody wants to come to the talk because you don't want to say that I'm having a fertility problem. So I said, well, the easiest thing to do is create a policy and then use that to promote NISIG and the conversations. So I went to I'm sitting on the exec team, but I went to every member of the exec team individually because, again, it's not something I wanted to do at a board meeting because it's very close to my heart. And I told them my story. And I said, here's the policy I want to release, but I want to do one more thing. I want to give that policy to anybody who wants it, so they don't have to start from scratch. So they don't have to go in and say, oh, this is why I want the policy. I also ran a little webinar as well about influencing, so people who didn't know how to bring it in, I gave them tips and tricks for having the conversation, for saying, this is why I want this. And every single of the exec team, men and women, were do it, do it, do it. One man broke down in tears, because he said, I've just gone through the journey. Oh. One of the women said, did it years ago. There was no help, do it. It was phenomenal.
So you're just tapping into an audience that was already there.
It was phenomenal. But what it did was, so number one, we got the conversation going. In so many workplaces, I think over 100 workplaces have taken it. But in my workplace, people come to me now just for the chats. So 2 men have come to me to say, can I just talk to you about how to support my wife and how my feelings? That's amazing.
Yeah, that is worth a round of applause, ladies and gentlemen. To give from your own story like that is important. But John, I suppose that goes to the point I want to raise to you, that the value of the right policy. Those policies,
Without a doubt.
those policies were brought together from sadness, from experience, from just all the challenges that were there.
Yeah.
But if the right policy is in place, your employee is going to feel comfortable talking about it.
Yeah, and that is such a good story, and brings together a lot of what we spoke about already, I think. But the right policy, absolutely, and it doesn't matter whether it's infertility or menopause or indeed substance abuse or anything else. It's a great place to start because it brings people together and gets the communication going. But so often you find in areas like substance abuse, people just don't go there because they're afraid of it. Yeah. So I think, start there, get your group together. You've always become a champion from that point of view, which I think is important as well for areas like infertility and menopause, to have some body that they know and trust and who's going to champion the cause. So I think that goes hand in hand with that policy. But policy, I mean, it's the same sort of principles that we spoke about earlier on in terms of you do your workplace assessment and you see what's needed inside there, both from a structural and organisational point of view. You put in place supports, and then you promote. You promote the story, you promote the narrative. You have workplace champions who are going to do that as well, and you can be successful. I mean, that sounds like a really good workplace. I gotta say.
But can I point out that risk management is a huge thing. You worry about losing staff because they might be poached by others who might pay more. You're concerned primarily pay, but then conditions has crept in as another thing. But policies. I mean, does anyone talk about the risk of perhaps losing someone like yourself because the policy isn't there to support you, and then they find out years later, well, that's why she left. I mean. Risk is huge of losing key people.
It is, and look, it all depends on how you look at risk in those situations. But yeah, absolutely, for the modern workplace in Ireland, where we've got full employment, you want to attract the right people in and keep them as long as you can. It makes sense in every way. Happier, more productive. And much less costly.
But that's exactly it. I think that's exactly it. Like when I was looking at the menopause, and we do have fertility as well, and I think the best part of that is talking the words, using the words, going out there talking about it. But when I was introducing it, I was like, well, you're interested in talent attraction, you're interested in talent retention, you're interested in the gender pay gap, you're interested in increasing senior leadership, gender balance in senior leadership, etc., etc., etc. So you're interested in the menopause, and you're interested in early pregnancy loss, and you're interested in fertility, because this is all about what we're doing.
It's almost like the floodgates have been opened, and we realise, guess what? women have specific issues that are specific to them.
Yeah.
And if we ignore them, we do so at our peril.
Absolutely. We
And
can't afford
these
to.
are probably presenting as mental health issues. So when reflecting
Yes.
back,
Yes.
They present differently, but it's the intelligent
that's
HR
the way they're
department that
presenting.
sees what they are.
And then on discussion, you find out the problem behind it is this. But so many say, well, I didn't really want to say because I'm not comfortable talking about infertility or menopause or menses, you know.
But, I mean, just to follow on a couple of things you're saying there, we this year achieved a 50-50 male-female exec team, and I think part of that is the environment we create for women in our workplace, and our next 2 levels down are very healthy as well with the ratio. But also on losing people, we nearly lost somebody recently because of her symptoms of menopause. She was about to throw the towel in, and I was like, whoa. Tell her we can do this, tell her we can do this, tell her we can do this. And she's back and she's okay and she's had her she's good. And that's really important.
I think certainly in general practice, when we get it right, if we get the perimenopause and menopause journey right, women just turn around and kind of go, this is my Cinderella moment. Or as I heard from someone, I'm 38 again. You know.
Yes.
Well, I'd imagine it is that terrible phrase, I've been heard or I've been seen. You know, sometimes that can be a negative. In this context, it's a good thing.
It's a great thing, you know, and to say, you are you. It was always there. You know, you have no say on the fact that this hormone level is going to go down. It's going to happen. It's inevitable. As it started, it's going to end. And how do we navigate that latter part of the journey successfully? Well, we can help you do that. We can help you do that in the workplace. And certainly from a clinician point of view, we will do everything we can to support you.
Stephanie, you talked about the importance of men and the support that they can give, which is brilliant. And it's fantastic that they do that. But Sumi, if I can just finish up with you in the 2 minutes we have left, the role of men as advocates in the medical space where you operate, in the HR space where many of the people watching will operate, in the managerial space. I mean, is it just that we have to be a little bit more aware, or do we need to do more?
You need to be completely aware. You need to be shouting and using the platform of being a man to elevate the women in the workspace to say, these are real issues. And these are going to happen to my entire workforce in keeping with recruitment and retention. We've good people here. They happen to be female. So what? We can make this work. And from the very simple, almost token comfort packs to supporting our employees through the workspace, to getting them the right supports coming into a medical journey, be it around infertility, or signposting them to people that may know possibly a little bit more around the perimenopause and menopause, all of that is really supportive. And then understanding that as a man, I've got a partner who might be female, I may have a sister, I've got an aunt, I've got daughters, I've got cousins. So it just doesn't stop with you.
Yeah.
It's that community spread that's important.
Yeah, and I suppose you ticked on a very important point there. You don't have to deal with it. You can identify it, provide support, and then turn around afterwards. Did that go well? You don't have to be the person on whose shoulder they consistently cry, because that's what men are worried about. I hate to say it, but that's what they're worried about.
Oh, you should see my partner.
Yeah.
He's run a mile.
But wouldn't it be great, instead of these issues presenting as mental health issues down the line, right, wouldn't it be great if they were dealt with early on,
Absolutely.
with an umbrella policy where people are enabled to talk about the issues and they never get to medical?
And even the idea that this conversation has been so easy to have with all of us. We, as I mentioned earlier on with Sinead, we've been doing this now. This is our 4th year doing this. Even 4 years ago, we wouldn't have had this conversation in the open and free way that we've had it now.
Yeah,
and that just shows you how quickly we have moved on in that period of time. It's been an absolute pleasure, ladies and gentlemen. A huge appreciation for Dr. Sumi Dunne, Joanne Healy, Dr. John Gallagher and Stephanie Brady.